focusing on you. From your team of experts at Sylvester Comprehensive Cancer Center, South Florida's only National Cancer Institute designated cancer center.
When Richard Dapaah suffered severe back pain while in Italy with his wife, he never imagined it was cancer.
I ended up on the floor for a number of hours and was taken out of the house in a stretcher.
Richard had multiple myeloma. He traveled to meet with Dr. Ola Landgren, director of Sylvester Comprehensive Cancer Center's Myeloma Institute.
Multiple myeloma is the second most common blood cancer. Risk factors for multiple myeloma are not entirely clear. It has been found for many years that people with African American descent have a higher risk of being diagnosed. Also, the age of onset could be 10 years younger. The treatment for multiple myeloma has changed quite a lot. We use immunotherapies that refer to antibodies that are designed to find proteins expressed on the surface of myeloma cells. We also use small molecules that can be blockers of certain pathways or certain functions in the cells.
Rather than treating Richard with chemotherapy, Dr. Landgren put him on a clinical trial using a 3-drug regimen to attack the cancer cells. The goal was to get Richard to where the disease was undetectable.
So there was no chemotherapy involved. And we also had minimal residual disease, or MRD, detection as part of the trial. So that meant that we could actually treat Richard till he'd reached that point when there was no detectable disease.
The Sylvester Myeloma Institute is at the forefront of precision medicine.
Better profiling of individual patients' disease and individual patients' immune system, that is a critical piece going forward, and that's something we are working on.
Richard is off treatment and jumping rope, something he never thought he'd be able to do again.
Coming back to it's been surprisingly easy and pain-free.
Richard feels great and tied the knot in Italy last year. He's grateful to have found Dr. Landgren and travels to Miami from Tennessee to be monitored at Sylvester's Myeloma Institute.
I always felt like if I could get to someone like Dr. Landgren and do what I was told, then we'd have the best chance at fighting the disease.